Palliative care from Carelon provides an enhanced level of personalized and compassionate support to help ease the difficulties of living with a serious illness.
I was first diagnosed with aplastic anemia in January of 23. Only then later, 6 months or 5 months later, I was diagnosed with stage 3 ovarian cancer. Initially, I didn't know what palliative care was, but I also didn't want to spend a lot of time in the hospital, and I didn't know that with my diagnosis what the future would hold.
Palliative care is care that allows me as a provider to come into a patient's home and really get to know the patient, build a relationship with them, and make sure that the care that they're receiving from their providers and specialists is aligned with the goals that they have in mind for their care.
My first visit with Jenni, I was pleased because she just was real comfortable. It wasn't just a nurse coming like me. It was somebody that knew a lot more than me. And I was impressed with that.
In the beginning of my care with Erin, she had just recently received her diagnosis of cancer. So there were a lot of emotions going through just handling her diagnosis and digesting just that information. At the end of each of my visits, my notes get sent over to each of her providers to keep them all informed. So a lot of what I'm doing is just sharing of information with these providers specifically, and making sure everyone's on the same page and aligned in the care that Erin is receiving. During a recent visit with Erin, she had expressed that she was feeling some anxiety and a lot of worry about her treatment path and the decisions that were being presented to her. And so I really encouraged her to allow me to collaborate with our social worker and have them get involved to help support her and her mental health through these decisions.
What I appreciated most is that I started realizing palliative care was for me also. I felt included. So, it was part of the team.
By building trusting relationships with our patients, it makes them more comfortable and more apt to call in when they do have a need. The care we can provide through a 24-hour urgent care line. If they're having a concern or a symptom that we think may require medical management, we can treat them with medications. We can provide medical management with things that they have in the home, with the overarching goal of keeping them out of urgent care and out of the hospital.
I see people that are going through some similar things, and I would recommend people to look into palliative care, to look into places like Carelon, to take advantage of opportunities that are there for support.
For more information about Carelon, please visit us online. To schedule your first appointment, give us a call